So welcome everyone to our August Teach Educational Rounds. Here with us today we have Dr. Trisha Tulloch and Madelynn who will be presenting on what clinicians really need to know about vaping and vaping cessation in youth. So I'm going to go ahead and get started with our KMH land acknowledgement. So Trisha, if you could go to the next slide. Awesome. So KMH is situated on lands that have been occupied by First Nations for millennia. Lands rich in civilizations with knowledge of medicine, architecture, technology, and extensive trade routes throughout the Americas. In 1860, the site of KMH appeared in the Colonial Records Office of the British Crown as the council grounds of the Mississaugas of the New Credit, as they were known at the time. Today, Toronto is covered by the Toronto Purchase Treaty No. 13 of 1805 with the Mississaugas of the Credit. Toronto is now home to a vast diversity of First Nations, Inuit, and Métis who enrich this city. KMH is committed to reconciliation. We will honor the land through programs and places that reflect and respect its heritage. We will embrace the healing traditions of the ancestors and weave them into our caring practices. We will create new relationships and partnerships with First Nations, Inuit, and Métis, and share the land and protect it for future generations. Now you can go to the next slide. So thank you so much everyone who already introduced themselves. If you have not already, please introduce yourself in the chat and let us know which traditional territory you are joining us from today. If you're not sure, I'll put this link in the chat for you to find out. And you're also very welcome to share something that you're doing to learn or improve your ongoing commitment to reconciliation. And while you do so, I'll share a bit about myself for those that are joining our Teach Educational Rounds for the first time. So my name is Natalie, and like KMH, I'm currently located on the lands of the Mississaugas of the Credit. I'm of Italian descent. My grandparents arrived in Canada from Italy in 1958, and I've lived in the city of Toronto for almost 2 years now, where I've truly grown to appreciate the community and the vibrancy that this land has to offer. I acknowledge the privilege I have as a white settler to live here and be within close proximity to all my daily needs, especially as someone with type 1 diabetes. So I myself am committed to reconciliation. I continue to listen and learn about the stories and cultures of various Indigenous communities and ensure that their voices are heard and reflected within my work and personal life. So thank you everyone for sharing. In the interest of time, I'll keep going with some housekeeping items. So you can go to the next slide. Thank you. So if you're interested in receiving a letter of completion for these Teach Educational Rounds, please make sure you're registered for the webinar and completed the pre-learning assessment. As well, make sure you signed into the webinar using your full first name and last name so we can track your participation. And please also make sure to complete the evaluation and post-learning assessment that will be emailed to you by the end of today, and you'll have 1 week to complete that. Along with that, if you registered, you will receive a copy of the slides as well as the recording afterwards if you would like to review or share with any colleagues. Next slide. So here's a little bit more information on our presenters today. First up, we have Trisha Tulloch, who's an adolescent medicine specialist at Sick Kids and an assistant professor in the Department of Pediatrics at U of T. She is now currently providing consultation with the Nicotine Dependence Service, or now known as Intrepid Lab. She has a clinical focus on youth tobacco and vaping cessation, as well as improving access to care for young people with concurrent substance use and mental health disorders further complicated by chronic illness. She is actively involved in teaching and serves as the Vice Chair for the Royal College of Physicians and Surgeons of Canada. So welcome, Trish. And next up, we have Maddie Hannah, if you could just go to the next slide. Awesome. So Maddie Hannah completed her PharmD at U of T, and she continued at KMH as a clinical pharmacist and medication safety pharmacist, and is now the inaugural pediatric psychopharmacology fellow within the Gary Hurwitz Center for Brain and Mental Health at Sick Kids. She is currently pursuing a Master of Science in Pharmacy degree. And her clinical practice focuses on pharmacological management of pediatric mental health and substance use disorders. Her current research explores how TikTok is being used for psychiatric medication information. So welcome, Maddie. And next slide. No disclosures for them to report. Awesome, next slide. So please know that the content of Teach educational rounds is centered on evidence-based guidelines from the following sources. Nonetheless, these materials, as well as the verbal presentation and any discussion, represent only general principles, and they do not remove the need for clinical assessments or treatment plans by healthcare professionals. Next slide. And go again. Next slide. Thank you. So please feel welcome to use the chat feature throughout the webinar to post any comments or answer any prompts from the presenters. To do this, just click on the speech bubble icon in the control panel. Just ensure you select everyone so that all panelists, hosts, and attendees can read and respond to your comments. You're also very welcome to use the reaction feature throughout the webinar if you feel like sending a smiley face or a thumbs up at any point. So yeah. With that, I will hand it off to our presenters to take it away. Thank you, everyone, and enjoy the webinar.
Thank you, Natalie, for the introduction, and thank you, everyone. We're really pleased and excited to be here to talk about this topic, and recognizing that we don't have a lot of time. Natalie, I think you mentioned that you'd be able to monitor the chat feature as well. So unfortunately, I can't see it from here, so let us know if there are questions that come up, and please feel free to ask questions throughout, but we are limited in terms of the time, and we've got a fair bit of content to review. So without any further delay, and I'm going to do my best to navigate this. Here we go. Okay, in terms of our learning objectives, so today we would like to review the current trends in vaping among Canadian youth and young adults. We'd like to be able to describe the opportunistic approaches for screening and assessment among youth and young adults who endorse vaping, and discuss the current state of evidence for non-pharmacological and pharmacological vaping cessation strategies for youth. In addition to that, we'd like to be able to discuss identifying key facilitators and that promote treatment engagement, harm reduction, and prevention among youth. So we have a question for the participants, just to get a sense of your involvement, your care, the care that you might be providing for youth within your setting. So just if you could, within the chat feature, for this initial question, so within your clinical setting, how many youth or young adults do you provide care for? So if could add 1 in the chat feature if it's less than 10, between 10 and 25, 2 and 3 between 25 and 50, and 4 greater than 50. Maybe we could just get a sense of like the majority.
Yeah, I'm not sure if you can see Trish, but I would say majority is 1.
Okay.
Yeah.
Okay, that's good to know then. Okay.
Still a good mix.
Yeah, there's definitely a mix, but majority women.
Okay. And were there any like just in terms of comments about so we mentioned young adults, so less than 25. Just wondering if these youth are requesting or presenting with the intent with respect to vaping cessation. Maybe if there are any comments or okay, I just saw someone mention constantly. Okay, that's really helpful. Okay. So this is great. It's a great start to a really important topic. So in terms of the first objective, I will hand this over to Maddie to review the current trends in vaping among Canadian youth and young adults.
Perfect. Thanks, Trish. You can go to the next slide there. So we'll start with national trends among youth. So this is the data from the Canadian Student Tobacco, Alcohol, and Drug Survey, or CS-TADS, in the 2018-2019 cycle. The 2021-22 cycle was actually completed and published in May. And so I was planning to show you this updated data, but unfortunately it was temporarily removed from the Government of Canada website pending some corrections this month. So I do have a couple of numbers that I'll verbally share as I go through to give you a bit of a sense of the trends more recently. But this was a survey of almost 63,000 youth in grades 7 to 12 across 10 provinces. And this the results showed that 20% of students reported using an e-cigarette in the last 30 days, which is double what was reported in the 2016-17 cycle. And to give you a sense, this number was about 17% in the 21-22 data that was taken down, which is a little bit of a dip, but it was also during the COVID-19 pandemic where there was closures, which may have limited access. A whopping 12% of that sample reported vaping daily, and in the 2021-22 cycle, this published number was about 8.1%. And then of those who reported vaping in the last 30 days, 40% reported vaping daily or almost daily, and 42% of the sample had only ever vaped and not used cigarettes. So we do know that kids are using vaping products before smoking a cigarette, and that the majority are obtaining their supply from a social source, with a quarter still obtaining from retail sources, and this is underage. Of students who have tried both cigarettes and vaping, 41% have tried a cigarette first, and 47% have tried a vaping product first. You can go to the next slide. So this figure combines adolescent data from 3 national surveys, so the Canadian Tobacco Use Monitoring Survey, the Canadian Tobacco and Nicotine Survey, and then the Canadian Tobacco, Alcohol and Drug Survey, looking at the prevalence of both cigarette smoking in blue and e-cigarette use in orange in the last 30 days as the trend over the years. And as you can see from the blue line, cigarette smoking among adolescents aged 15 to 19 has continued to decline, which is excellent, but we do see this alarming increase in vaping rates in orange there. You can go to the next slide. This figure is from the Canadian Tobacco and Nicotine Survey in 2019 in blue and 2020 in orange, which shows you the prevalence of past 30-day vaping in different age groups. So in 2020, for example, we see that 14% of adolescents aged 15 to 19 and 13% of young adults aged 20 to 24 had vaped in the past 30 days, which is much higher than the 3% of those aged 25 and up. And so this just highlights how much of a concern vaping is in youth and young adults. Next slide. And so just to highlight some Ontario data, CAMH's Ontario Student Drug Use and Health Survey is a survey done with Ontario students in grades 7 to 12 every 2 years. So the 2021 cycle included 2,225 students from 31 different school boards. And with respect to drug use, we see that e-cigarettes or vapes are among the top 4 substances used in the past year, behind caffeine, alcohol, and cannabis. And I've put an arrow there to show you where that is. And that 15% that's reported here in 2021, again, is an improvement from the 2019 cycle, which had 23%. However, this was again during the pandemic, which may have limited access. Students reported that alcohol and e-cigarettes or vapes are the most readily available drugs they can access. And for those who did self-report vaping, which is about 15% of the sample in the past year, or about 340 students, 84% of those, or approximately 287 students, report that they're vaping nicotine as opposed to vaping something else. You can go to the next slide. And so to also think about where Canada sits with respect to vaping prevalence, unfortunately, adolescent vaping in Canada is among the highest internationally. So this was a study published by the Hammond Group comparing vaping rates between Canada, the US, and England from 2017 to 2019. And so to orient you, the light blue bar is vaping prevalence, the brown bar represents those both vaping and smoking cigarettes, and the dark bar is cigarette smoking only. And so the prevalence of vaping within the last 30 days increased significantly from 2018 to 2019 among all 3 countries. But as you can see, this was substantially more prevalent in the US and Canada compared to England. And you can see that just by the size of the blue and brown bars compared to England. It's not shown here, but the study also showed significant increases across the years 2017 to 19 of those reporting vaping in the last week, and those reporting vaping 20 or more days per month in Canada and the US, and that was not seen in England. And when the most recent Canadian Student Tobacco and Drug Survey came out in May, that was since taken down, the same Hammond Group that did this study had provided a comment to the CBC indicating that Canada is still sitting among the highest worldwide. The next slide. And so the last thing I'll point out here is a newer trend to the vaping industry, which is the use of synthetic nicotine in vaping products, as opposed to plant-derived nicotine from the tobacco plant. So manufacturers are marketing these products as quote-unquote tobacco-free nicotine, stating that the advantage of these products is essentially an odorless and tasteless product that improves the taste of vaping liquid flavors. Puff Bar was the first brand to advertise these products in 2021 in the US, but they are available in Canada as well. And they had actually used a loophole in the FDA regulations in the US that focused specifically on tobacco products, as the product is not derived from tobacco, which allowed them to avoid this costly pre-market authorization process. The regulation of these products in Canada is largely unclear. Our Tobacco and Vaping Product Act regulations do include both tobacco and quote unquote vaping products. So theoretically, these products should be covered under the Act. But the overall issue with these products is that the synthetic nicotine product is not the same chemical makeup as plant-derived nicotine. Plant-derived nicotine contains what's called S-nicotine, and then the synthetic nicotine product is a mixture containing both half S-nicotine and half of its mirror image R-nicotine. And R-nicotine is about 10 times less potent than S-nicotine and has raised even more safety concerns because very little is known about the pharmacological effects of R-nicotine in humans. And studies have also shown that nicotine concentrations in these vaping products containing synthetic nicotine, A, have shown that they've found impurities in the products, but B, that they're also not labeled consistently. Some are labeling the total concentration of R and S nicotine, some are labeling only S nicotine, and these confusing labeling practices might expose unknowing people to high levels of R nicotine or to lower S nicotine levels than they're used to, causing them to then purchase products with a higher total nicotine content. So next slide. And what's interesting is that the youth's perception of tobacco-free nicotine and how, what's interesting is the youth's perception of tobacco-free nicotine and how this can impact the products that they're purchasing. So this was a survey of a sample of just over 1,600 adolescents aged 13 to 17 in the US, which assessed youth knowledge of nicotine sources in e-cigarettes. So either if it was from tobacco plants or other sources, or if they were unsure, as well as their awareness of e-cigarettes containing synthetic nicotine at all. And in the left graph in green, you can see that most youth were either unsure at 48% or didn't think at 20% that nicotine in e-cigarettes comes from tobacco plants. Similarly, in blue, most youth were unsure or did not think that nicotine in e-cigarettes came from other sources. And then in orange, you'll see that the awareness. So there's low to moderate awareness that e-cigarettes contain synthetic nicotine at all at about 28%. And this number increased a little bit to 48% among those specifically who report that they use e-cigarettes. The youth were then shown a picture similar to the bottom picture at the screen there, which depicted a website selling vaping products where they changed different label descriptors of the product, such as the use of nicotine or not on the label, whether the source of nicotine was included, such as indicating tobacco-free or synthetic nicotine, or not including the source at all. And in the graph on the right there, you'll see the purchase intentions of youth based on the products shown to them in the survey, specifically those who used e-cigarettes. So they found that using a descriptor of tobacco-free nicotine in the product description increased purchase intention more than if the term synthetic nicotine was used or if no source of nicotine was indicated at all. So this study concluded that most youth do not know or have incorrect beliefs about the sources of nicotine in e-cigarettes and low to moderate awareness of synthetic or tobacco-free nicotine in e-cigarettes. And describing synthetic nicotine as tobacco-free nicotine increases purchase intentions among youth who use e-cigarettes. So the authors then called for their work to inform efforts by regulatory bodies to more effectively regulate the language used to describe synthetic nicotine products. Next slide. And so just to summarize and set the stage for the rest of the talk, vaping rates among Canadian youth are unacceptably high and are among the highest worldwide. A recent trend that we've been seeing is the use of synthetic or tobacco-free nicotine, raising even more safety concerns. And we know that youth awareness of these products is suboptimal. And so with that, I'll pass it off to Trish to review screening and assessment.
Thank you, Madelynn. So just on that note, just going to slide. So our second objective, as just briefly mentioned, is we will be talking about screening and assessment among youth and young adults. But I think just going back to what Madelynn has mentioned, really to emphasize how critical this is in terms of our understanding specific to youth and their suboptimal or not ideal awareness with respect to what they're actually consuming. In addition to that, I'd also like to point out that it is also important to understand the context. So are parents aware? What we're seeing clinically is oftentimes parents, in an effort to reduce the harm, at least from their perspective, they may in fact be purchasing products also without the awareness of what they're specifically purchasing in terms of the amount of nicotine. In addition to that, what is actually within the e-liquid that they're purchasing. So I think it's really important to emphasize what has already been mentioned. And further to that, I think it'd be interesting to see where we all land in terms of the question here specific to regulations. So the question, our next question is, which of the following regulations are specific to Ontario? So for this specific question, again, if you could use the chat feature, the first answer that's offered or statement that's offered, the age to legally purchase vaping products is restricted to those under the age of 19. For B, the requirement to ask for ID for those under the age of 25. Is this a regulation that's specific to Ontario? C, the sale of non-tobacco flavors, with the exception of menthol, for those under the age of 19, or D, all of the above? So and maybe, Natalie, you could help me get just a sense of the lay of the land there in terms of.
Yeah, so far it's looking like some A's, some D's. There's a bit of everything, I would say, but
Okay.
mainly I would say A and D.
Yeah.
Yeah.
Okay. All right, let's see where we land here. Oh, more answers were coming in. This would have been a great poll. So it's in fact all of the above. And so we'll talk about that with just a bit more of information. I think there was a question about where the regulations, specific regulations were. So we have our federal regulations and we also have our provincial regulations. So just specifically touch on the age. So across Canada, there's a bit of variability, but in terms of from a federal perspective, it is 19 and 18 and under, but some of the provinces have made additional regulations, where they've added additional regulations. So for Ontario, it's in fact 19. So under the age of 19, the selling of vaping products are prohibited. So you can see from this graphic where there's variability across the country. And then it's quite busy, but I think it's important to note that this graphic depicts where we have our federal regulations. So that's highlighted on my left, your right. And then I've also highlighted our provincial regulations. And so just to summarize, in terms of federal legislation, there's a restriction in terms of the tax on vaping devices or liquid. There are restrictions on ads, advertisements in stores, restrictions in terms of advertising and sales on the whole, and then restriction in terms of the maximum amount of nicotine levels. In terms of provincially, I've mentioned the three, but just to review, so in fact, there are restrictions in terms of the age to purchase vaping products and so it's under the age of 19. There's a requirement for a proof of age if under the age of 25. And then restricted sales of non-tobacco flavors, with the exception of menthol. So I think that's really important to note. And so in addition to that, just in terms of understanding that, in fact, yes, we do have these regulations, but as Madelynn has already pointed out, there are loopholes. And I think we all recognize this, but again, it's really important to ask these questions and to understand what our adolescents or young people are in fact consuming, so youth and young adults. And again, what do their caregivers, what's their awareness in terms of what they're consuming as well, or providing? I think, were there any specific questions that came up that I just maybe to answer. Natalie, you can let me know if that's okay, and then
Yeah, just
feel free to
maybe
end.
some comments. So Jenna said a lot of youth I spoke to either do not get an adult/older youth to purchase for them, or a majority purchase online.
Right.
Yeah.
Exactly. I'm glad that you brought that up, because there certainly is there's a lot of discussion about where these regulations are with respect to the access, the online access, and then of course youth, as we know, being able to acquire ID, etc., in order to be able to access, or they have an individual who's older to access and purchase the device. So again, so youth are still vaping, and we are obviously quite concerned that there's an alarming increase. And internationally, we're now Canada is really the kind of the one country that it's concerning when we think about the proportion of adolescents and young adults that are in fact vaping. So I'm mentioning asking about vaping as we're delving into this topic around screening and assessment, and really here just to point out that we do have a few tools that are available to us in order to guide our approach. So I'll just kind of touch on a few things that would be important in terms of the questions that we would recommend that you ask as you're engaging youth on in this topic and in this discussion. So this is from the Canadian Pediatric Society. You can access this handout on their website. It does provide a fair amount of detail in terms of the questions and the rationale for the questions that you can ask during an encounter. I think where there's a lot more emphasis that we would recommend a bit more attention being focused on is where the motivation piece is highlighted. So the question about why did you start, or why do you continue to vape? When we think about engaging youth, these are the questions that seem to be the most critical in terms of continuing and in continuing their engagement, but also understanding how you may be able to effectively intervene. So additional questions here. So we're just going to go back. Asking about what they're using, what's within their device. We're focusing on nicotine today, but in fact, of course, we should be asking about additional substances. Asking about the amount of nicotine, and we'll be going into this particular area in a lot more detail, just because we're seeing more and more that we need to really understand the amount of nicotine that's consumed on a daily basis. Asking about the cost, asking about what does nicotine use, or what does vaping look like throughout the day for the young person. So I mentioned the amount of nicotine, and so I'll just briefly touch on this piece, and both Madelynn and I will be bringing this into towards the end of this talk when we discuss a specific case. But this is a really helpful table from the research group at the University of North Carolina, where they were able to look at the amount of nicotine in terms of the equivalent number of cigarettes, and also the equivalent number of cigarettes in terms of packs of cigarettes for various devices. So they looked at disposables, they looked at pods, and then they, in addition to that, also looked at the amount of nicotine found within the e-liquid, or in this case, it's described as the e-juice. So just as an example, if we were asking a young person if they were aware that they were using a pod that had 20 milligrams of nicotine per milliliter, we would need to know what the volume was for the amount of e-liquid. And with that information, we could then be able to calculate the amount of nicotine within the pod. And beyond that, we'd be able to understand how much nicotine they're consuming per day. Again, we'll be able to talk about this in further detail. I think the important thing to highlight here, though, is that what we know is that even with the labels as they currently are, as they currently stand, there is evidence that suggests that the amount of nicotine within the e-liquid as labeled does not necessarily correspond to the accurate amount of nicotine. So this is where this becomes a bit tricky. So we have to do our best with the information that we have, but there certainly is some evidence, a fair amount of evidence now that supports that, in fact, even what is labeled isn't as precise.
Right.
We have a really good question for you. Emily Bradbury says, how are they getting greater than 20 milligrams per milliliter when the federal legislation has banned it? And is it all online from the States, or are they finding the 35 and 50 milligrams per mil in Canada?
So I love that question, because I can tell you clinically, and maybe just to take a step back, I always ask, where are you purchasing? So I think just in terms of when you are working with youth and young adults, really to ask that question and engage them on this this particular topic. And oftentimes they will let you know that they can go into pretty much any store, any convenience store, and acquire 50 milligrams. And they'll tell you which devices tend to have 50 milligrams. And as previously mentioned, Madelynn had pointed out the important piece specific to synthetic nicotine, that this really has been where we've seen a huge shift. And I would say more times than not, it is 50 milligrams per milliliter that has been at least disclosed as what youth are using. I don't know, Madelynn, if there's anything else that you've noticed or you've, yeah.
No, I think that's great.
Yeah.
Yeah.
Okay, and just in the interest of time, just quickly in terms of this, the types of questions that I would also suggest thinking about, or asking who might be using within the home, how they're purchasing, are they using throughout the day in school, in the classroom, in the bathroom, asking about what it looks like within the school environment, what it looks like during their lunch period. Are they with friends, without friends? Is it being used for a purpose? Some youth will actually endorse using or vaping nicotine for the purposes of appetite suppression, and it could be in the context of disordered eating or an eating disorder, as an example. So I'll just go ahead. And so there are a number of different questionnaires that can be incorporated within an encounter. Understandably, we sometimes have a limited amount of time, but I'll just point out these questionnaires, and then you'll have access to these with the handout that will be provided. So this is one questionnaire that is the CRAFT, a well-known screening tool that typically has 6 questions, and it focuses on the establishing whether there's problematic substance use. In this case, it would be specific to vaping and nicotine or nicotine use. And in addition to the CRAFT here, they've added the questions that are found within the Hooked on Nicotine checklist for vaping. So these are additional questions, again, looking at the degree of nicotine. They use the term addiction, dependence, the idea being that there is a degree of nicotine that is being sought after or craving, and this is a way to be able to look at the severity of that. The CRAFT, what is helpful is that there is evidence of a correlation with the DSM-5 criteria for substance use disorders. So as you can see with higher scores, you can see that there is a higher, essentially, probability of a DSM-5 diagnosis or meeting criteria for the DSM-5 diagnosis for a substance use disorder. So again, I find that this can be a very helpful tool to use if you had to choose among the other tools, and specifically the CRAFT plus N for the purposes of this topic. In addition to that, there's a quick scale that can also be used, the e-cigarette dependence scale, for questions similar to what we've been trying to establish in terms of the degree or the dependence on nicotine. So again, and this is actually specifically tailored to vaping. So this can also be helpful to use this as well and incorporate that in your assessment. And then lastly, just to point out, so we've started to look at the cohort within the STOP program. So those youth, and this is preliminary, hasn't been published yet, but just wanted to point out that this group of young people that are presenting for treatment, so treatment-seeking youth, younger than 25. So we have a small group of those ages 14 to 17, and a somewhat larger group of young adults 18 to 25. So we were starting to look at what the characteristics are of this this cohort, and we have some preliminary data just looking at their use. And I think I just wanted to point out that on the whole, when we think about how much or what they're actually using, what we're seeing for youth, the majority are using e-cigarettes when they're presenting. They aren't using a combination of cigarettes and e-cigarettes. I think going back to the main concern being why they've initiated the e-cigarette use, and then young adults, you can also see that majority are also using e-cigarettes exclusively. So just to point out a bit of that data, and we'll talk a little bit further about that further into this presentation. And just so to summarize, yep, sorry.
Sorry, there's just a quick question in the chat. Leslie's wondering if we're able to provide NRT to youth under 18 in Ontario.
Yes, and we'll be talking, and that's a great segue to the next part of this talk. I just wanted to point out, again, just to emphasize the point around suboptimal awareness, so low awareness of what youth are using in this particular paper by Michael Caton and the group here. They looked at the qualitative information that explores the reasons, the rationales for youth and young adults who are vaping e-cigarettes. I think it's just important to note here that, again, emphasizing this point around low self-awareness of their pattern of use and their behavioral habits. So this is really a critical piece, and when we think about engaging youth, this is where we can, I think we can make probably a bigger impact in terms of our ability to really shift the dial when we think about effective interventions. So really, to summarize, ask about vaping, and beyond that, ask as many details as we can to really get a better sense as to what does vaping look like for this young person throughout their day. So I will hand this over to Madelynn to explore and discuss the state of evidence for both pharmacological interventions and non-pharmacological interventions for vaping cessation.
Thanks, Trish. You can advance to the next slide. So let's start with what evidence is actually out there right now for vaping cessation specific to youth and young adults. And so this was a scoping review published just a few months ago by a group of authors that are most likely very familiar to most of you. But they identified 13 articles reviewing both behavioral and pharmacological interventions for vaping cessation. 12 out of 13 of those articles did target youth populations. So 11 targeted youth aged 15 to 24, 4 targeted specifically aged adolescents aged 10 to 19, and there's some overlap there between the publications. And they found that half of those articles were primary research articles, 2 were focused on nicotine replacement therapy with behavioral strategies, 4 were focused on behavioral strategies only, and 6 were guidance or recommendation documents that were largely based on smoking cessation literature. And of all the articles that they identified, behavioral strategies and nicotine replacement therapy, or NRT, were the most recommended interventions. We can go to the next slide. These were the secondary guidance or recommendation articles that were identified from the scoping review, which most commonly recommended behavioral interventions and or the use of nicotine replacement therapy for this population. 4 of the 6 documents are extrapolated from smoking cessation data, and that included the documents published by both the American Academy of Pediatrics and the Canadian Pediatric Society, which I'll touch on in detail shortly. Next slide. So the scoping review essentially identified the small amount of literature that we currently have for youth with respect to behavioral and pharmacological interventions for vaping cessation, and identified that we need more good quality clinical trials to assess the effectiveness of interventions in this population. We can go to the next slide. And to summarize the state of evidence for vaping cessation in youth, we have a limited but growing evidence base to support behavioral and pharmacological interventions. Nicotine replacement therapy is actually the only pharmacological intervention that's been investigated in youth for vaping cessation, and recommendations for vaping cessation in youth are based on literature in vaping cessation specifically, but are also extrapolated from smoking cessation data. Next slide. I also just wanted to quickly review some guidance documents that have been published for vaping cessation. So this is the CAMH Vaping Cessation Guidance resource that was published in February of 2022, which again, I'm sure many of you are familiar with, which of course points to the little evidence available with regards to pharmacotherapy for vaping cessation for anyone, let alone youth, and that much of the evidence is extrapolated from smoking cessation. And so for that reason, nicotine replacement therapy at this time is considered off-label. Their recommendation essentially states that behavioral strategies should be offered, like one-on-one counseling, app or web-based programs, text messaging programs, or helplines with or without pharmacotherapy. And they identify that any of the available options for smoking cessation could be considered. We'll go to the next slide. And specific to pediatrics, the American Academy of Pediatrics put out an updated statement just a few months ago. Again, it's largely based on smoking cessation literature, but the main thing from this document, that's important to remember, is that evidence largely supports the safety of nicotine replacement therapy in adolescents, with no serious harm ever reported in adolescents, and there is a low potential for misuse. And with respect to pharmacotherapy, the American Academy of Pediatrics recommends that in the context of this good safety profile of NRT and the well-known consequences of untreated tobacco use, that pediatric providers consider the use of NRT for adolescents. They suggest for those who would meet criteria for moderate to severe tobacco use disorder. Next slide. These are the most up-to-date recommendations that we have from the Canadian Pediatric Society and the American Academy of Pediatrics. So the Canadian Pediatric Society published a position statement back in 2021 and highlighted that behavioral strategies should always be first line, which they state individual or peer group counseling, motivational interviewing, CBT, contingency management, mindfulness-based interventions, or web or app-based interventions, and that nicotine replacement therapy has been shown to be safe for use and can be considered to reduce withdrawal symptoms and cravings. And they recommend that NRT be considered for patients, A, who are vaping daily, B, for those with withdrawal symptoms or cravings that intervene with any cessation attempts, or in circumstances like hospitalization where the person's not able to vape. Principles of nicotine therapy, nicotine replacement therapy in youth is similar to adults, in that the recommendation is to use a nicotine patch as a maintenance nicotine dose in addition to short-acting nicotine replacement therapy to help with any breakthrough cravings. And they do also mention the use of bupropion and varenicline in the document, which are our other two first-line agents for smoking cessation in adults, but it doesn't have any conclusive evidence specifically in youth. And so it's really just based on expert opinion only. So this would also introduce new medications to the patient, whereas with nicotine replacement therapy, we're providing them with pharmaceutical grade nicotine, something that they've already been exposed to. The AAP similarly recommends behavioral interventions with or without NRT for moderate to severe tobacco use disorder, and then also recommends that combination of long and short acting NRT. And go to the next slide. And so let's put these recommendations into practice with a patient case. So this is your patient, TJ. He's a 15-year-old male, and he's presenting to the substance use clinic seeking vaping cessation. He's using disposable vape pens. The branding he tells you is Nicotine when you ask, and he thinks he's using about 80 puffs per day and estimates going through 1 cartridge per week. And he's not sure of the concentration of nicotine liquid that's actually in the pen. You can go to the next slide. And so determining how to dose nicotine replacement therapy is a bit different for smoking cessation, but it's still based on the same principles. So we know that e-cigarettes generally deliver higher concentrations of nicotine than conventional cigarettes, as Trish showed you, and I put the figure there again on the top right for you to refer to. But there can be a huge amount of nicotine in the pod, like up to 100 milligrams, which is approximately 100 cigarettes. And then the power of some e-cigarettes can be turned up or adjusted to increase the amount of nicotine that's delivered, which additionally is problematic. And we know that nicotine exposure from vaping is also variable. So we don't know exactly how much nicotine that the person is exposed to. But we can try to estimate the daily use of nicotine with the information that we can collect. So using the volume and concentration of nicotine liquid used per day. So the formula there on the screen is how milligram content of nicotine used daily can be calculated. So you would multiply the strength or the concentration of the liquid in milligrams per milliliter, and then multiply that by the volume used per day in milliliters. And then that would give you the milligram content of nicotine used daily. So you can go to the next slide. As mentioned in the recommendation and guidance documents, NRT is often offered as a combination regimen with both long and short-acting nicotine replacement products. The dose of the patch generally is based on the amount of nicotine used per day. So we have 7, 14, and 21 milligram patches available in Canada. But in practice, we tend to be a bit more cautious because, again, we don't have that conclusive evidence validating dosing in vaping. The nicotine exposure can greatly vary between devices, and we want to just avoid excess nicotine exposure in kids as well. There's also a ton of unregulated products that are out there that we actually have no idea what's in the cartridges and how much they're using. And anecdotally in practice, we've seen patients report that they're using huge amounts of nicotine, but then they find that a 7 milligram patch actually might be too much nicotine for them. So in general, it's best to start with a lower dose of nicotine replacement therapy and titrate up to manage the withdrawal symptoms and cravings. So depending on the amount of nicotine used daily, you could start with a low dose patch, like the 7 milligram patch, or you could just start with PRN short-acting agents and titrate up and then add a patch later if you need to. And then the short-acting nicotine replacement therapy agents are products that we have in Canada are on the slide. We tend to try to use gum or lozenges first before moving to an inhaler or oral spray, as these could be a little bit more reinforcing because they require the similar hand motions that using a vaping device or a cigarette uses as well. You can go to the next slide. So back to TJ. So let's look at how much nicotine he's actually using per day from vaping. We can estimate this. So he reports using 80 puffs a day or about 1 cartridge per week. So many times it will take some investigative work and you have to look up the product for more information so that you can estimate the daily nicotine use. So when we look up this specific product that he reported using online, the Inikin brand disposable vape pens are called InnoBars. And then we find out how many puffs are actually in a pen and then the volume and strength of the cartridge as well. And it might seem a bit redundant to know both how many puffs per day they're using and how often they're going through a cartridge, but it's helpful because you can calculate based on both, and then you know if they're similar that roughly you've selected the right product. And another way you'd be able to check this is you can ask them how much money they're using on these products, and you can go that way based on how much the product is. So from looking up the product online, and I pointed it out in red there in the arrows, you can see that this specific product comes in the 20 milligram per mil cartridge, which is the maximum strength that's allowed in Canada, not the maximum strength that's available and people are finding in Canada. And the cartridges are 2 milliliters each. So that equates to about 40 milligrams of nicotine or approximately 2 packs of cigarettes in 1 cartridge. You can then divide that by 7 days, using 1 cartridge per week. And so that works out to roughly 5.7 milligrams of nicotine per day. And you can double check that by calculating based on the number of puffs that he's using. So we know if there's 40 milligrams in a cartridge and a cartridge contains 600 puffs, you can divide that and you'll get 0.067 milligrams of nicotine per puff. Multiply that by 80 puffs that he's using per day, and then you get an estimated of 5.4 milligrams of nicotine daily. And so the estimates are relatively similar. So you can go to the next slide. And so we calculated his estimated daily use of nicotine to be about 5.4 to 5.7 milligrams per day. But again, this is just an estimate. We know that the exposure to nicotine from vaping is variable. And so we tend to just start low and titrate up to manage those withdrawal symptoms and cravings. So in this case, you could consider just starting with short-acting nicotine replacement therapy, like a 2 milligram gum or a lozenge every 1 to 2 hours as needed. You would monitor the use of the chosen product. If they're finding that the PRN is not enough to treat those cravings and withdrawal, and they're using them really frequently, then you can add on a 7 milligram patch to get that continuous level of nicotine in the bloodstream, and then continue to monitor tolerability and usage of the PRN agent. You continue to work with him to titrate up until their cravings and withdrawal symptoms are managed. And then so at this visit, he was prescribed a 2 milligram nicotine lozenge as needed every 1 to 2 hours with a plan to follow up it with Dr. Tulloch in her clinic in 1 week. And so I'll pass that off to Trish to see how the appointment goes when he comes back.
Okay. Yep, so TJ returns to clinic and he starts to talk about his symptoms. He initially says he doesn't think that the NRT is working. That's how he starts off the visit, and he's pretty frustrated about this. He says that he was using about 4 lozenges per day. He says it didn't really help with cravings, but then he also endorsed a number of new symptoms: headaches, nausea, increasing anxiety. So in terms of further history, we started to talk about the symptoms and the use of the lozenges and how he was using the lozenges throughout the day. And then he offered that he purchased a new device. And so the new device, I have a picture of the new device below. Further exploration, this new device, in fact, had, we're going to say 50, in fact, the label is different, but 50 milligrams per ml. And each of these pods were 2 ml in terms of the volume of e-liquid. So just going back and just walking through the steps once again, in terms of just making sure, again, that we're all on the same page in terms of calculation. So when you look at the strength, it's 50 milligrams per milliliter. The volume is 2 milliliters. So in fact, he was using 100 milligrams. He said he was going through 1 pod per day. So 1 pod per day, 100 milligrams per pod. So in fact, 100 milligrams per day, we go back to that original table. And as Madelynn has also mentioned, that's roughly, again, estimated to be about 100 cigarettes per day. So again, these are estimates. I think it's really important to note that at the end of the day, this is not an accurate, and I think we're all, I think, understanding that it isn't accurate in terms of the amount of nicotine that's probably seen or absorbed. But in this case, clinically, he's endorsing symptoms that do suggest that there may be toxicity in terms of the amount of nicotine within his circulatory system. So further discussions with him just to make sure that we had the accurate amount. He said he spent about $20 per week over the course of that week, and in fact purchased 6 pods. So when we looked at the amount, so 6 pods per week, so that's roughly about 1 pod per day. So as Madelynn had mentioned, one way you could verify the amount is to look at the puffs. If you don't have the puffs within the device, you can then again, then further discuss the amount that the young person is using in terms of purchasing the device, and then thinking about looking at how much the device actually costs and just doing a bit of a cost of comparison. So there was a question about the use of apps, and I think someone had asked about texting. Yeah. So the Truth Initiative, I think, was mentioned in the chat. I'm glad that someone mentioned quash, because in fact, this is one of those opportunities to engage youth in terms of other ways that they may be able to acquire information and use other approaches that are non-pharmacological in order to support vaping cessation. The quash app, in fact, does walk through a calculation in terms of the cost. And that's actually, again, an opportunity within the clinical setting to introduce the quash app and also have the young person go through that initial exercise. Again, they can get a better sense of how much they're using per week, per month, over the course of a year. And oftentimes it's a really important way to assess where they are in terms of the level of motivation. And they typically are quite surprised at the amount that they're consuming and the amount that they're actually spending. So we do have the links for the quash app, and again, these slides will be provided to you. Is there anything else that anyone would like to know? We don't have a lot of time for discussion, but I just, again, wanted to point out that, this is, TJ's coming back now to clinic, and he's wondering, why the NRT isn't working. And so now we're going to obviously explore this further, and we're now having the conversation about the amount of nicotine that he's using. Okay, so I'm just as I'm realizing the time and where we are, I'm just going to try to zip through this last really important piece about youth engagement and how do we keep TJ engaged in treatment. So our final objective was to identify key facilitators that promote treatment engagement, harm reduction, and consider approaches in terms of thinking about prevention. So as we mentioned, we have been, again, looking at the young adults and youth within STOP who are seeking vaping cessation. And what we have seen is that treatment does tend to be interrupted by, there's about 30% in terms of the amount of youth that are that do not return or have not returned within the first 4 to 6 weeks of treatment. That isn't much of a surprise given what we know. And so I think, again, going back to what are the things that help us establish whether in this case TJ would return to our clinic to continue with treatment. So we do need to talk about his his motivation. So his readiness, does he still think this is important? Is it still a goal? How much knowledge does he have in terms of the approach he should be engaged in? How confident is he and how comfortable he is? And so the readiness ruler is an approach that can be used in order to establish this information and continue ideally engaging a young person in terms of their request or their intent to reduce or stop vaping. So he does offer some information. He says he continues to vape because he's trying to alleviate the degree of anxiety. He says he's still motivated, and then he in fact gives us information that's specific to the degree of readiness. So how important, it's still very important to him to reduce or stop vaping. He says 9 out of 10. He then identifies that he doesn't think he has enough knowledge. So here we are. Now we have an opportunity. So he says he feels fairly confident, 6 out of 10, fairly comfortable, 6 out of 10. But the knowledge piece, again, is really key. So this is where, again, the Quash app, for example, can be really helpful, pointing to resources, but really having a discussion about where those gaps are in terms of knowledge. One of the gaps in this case was the amount of nicotine he was consuming. The fact that nicotine, in addition to the use of the short-acting nicotine as treatment, that in fact he wasn't supposed to ideally use those together, and he didn't recognize the amount of nicotine could have the effect it was having in terms of toxicity. So again, just opportunities to talk about that further. When we think about facilitators and that promote treatment engagement, additional questions can be questions that come up in terms of where does the individual, the young person, identify the barriers in terms of their personal recognition of barriers. So or even beyond that, what are the factors that may in fact facilitate vaping cessation in this case? So for TJ, he identified that he's still motivated, but he also points out that his friends and family members are vaping and it's easily accessible. So we've already pointed out the psychosocial has assessment, and so you can always defer to that in terms of exploring beyond some of the questions that have been suggested. And then I just wanted to make sure that you were aware that the data also supports precisely what we're discussing in terms of some of the factors, the barriers, and some of the factors in terms of the factors that promote ongoing use. So with the Youth Tobacco Survey from 2021, this is a US-based survey, but when they asked youth about the reasons, the rationale for initial use, it was peer-related. No surprise. I think we can all can understand and we can all appreciate how critical that is for adolescents and young people. The second factor was over 40% identified feeling anxious or having some symptoms that were correlated with potentially a diagnosis, a mental health diagnosis, depression, anxiety, and that those were the rationale, those were the reasons for why they were continuing their use. And so really critical in terms of, again, when we're thinking about the treatment approach, that we're taking a broad multi-prong approach, which I'll summarize towards the end, as we're considering that many youth have concurrent mental health, either a diagnosis that's formal or symptoms, and that they may in fact be engaging in vaping for the purposes of alleviating those symptoms, as another way of framing that as a form of self-medication. So I'm zipping through a bit of this just because I know that we're limited for time. In fact, I think I see Natalie smiling there. So let's just move to the piece that I was mentioning around the Quash app. So I've mentioned it here. There's definitely data supporting the use of behavioral interventions such as apps and messaging programs for youth. And the Truth Initiative, they have an app that they've actually studied quite rigorously. And this is the data. Their findings do suggest, again, that there is sufficient data that supports the use of vaping cessation text messaging as a way of an effective way in terms of supporting vaping cessation. So you'll have this data to refer to, and I will continue to talk about just the approach in terms of kind of the overall treatment at the end of the day, in order to continue to engage youth in a program or treatment approach. So if a young person isn't necessarily identifying the goal of cessation, at the very minimum, what we can do is engage in a discussion in terms of reducing the harms associated with their use. So this is a reference to the lower risk nicotine use guidelines through the Nicotine Dependence Clinic. This has been published, readily accessible, but this would be an approach, or this is a resource that could be used. We could refer to that, and we could also guide a young person to this information if in fact they're interested, if they'd like more information. So this may be, again, an opportunity with TJ where he's identified that the gap is around education. This may be something that we could do in terms of having a further discussion with him about what he knows around his use and how he might be able to reduce his use. Beyond that, there's the Vaping Cessation Guidance that has been also published. I think I did see in the chat that that was mentioned, but things specific to, factors specific to certain flavors, so cinnamon, cherry, menthol, products that contain diacetyl. For everyone to remember that at the beginning we talked about regulations, menthol in fact was not one of those that was regulated, and I think that's a really important piece, particularly in terms of access for youth. So we've already mentioned the Truth Initiative. This was here mainly for the purposes of providing this as a resource. And then finally, so really to summarize, it really does require a multi-pronged approach to treatment. So addressing mental health concerns, being able to provide education that meets meets the gap or addresses the gap in terms of the education, not only for the young person, but for the caregivers that may be involved in care that may also be using it within the home environment, to ensure that we provide behavioral interventions and offer that as part of a cessation plan. And finally, if pharmacological interventions are indicated, that we are going through at least an attempt to quantify the amount of nicotine and estimate, or the best of our knowledge, or best of our ability, in order to address and taper the amount of nicotine that's provided in terms of nicotine replacement therapy. And finally, as we've tried to summarize a bit of the anticipatory guidance and harm reduction, but there are, again, some resources that can really help with that. We've mentioned the lower risk nicotine guidelines. That could be a resource that you could point to both caregivers and the young person. And I think that that's probably summarizes, at least in terms of the overall approach from a treatment standpoint. And then finally, just in terms of our talk, it's I know that we've gone a little bit over time, but we in summary, we know that vaping continues to be a significant concern among adolescents, and the rates continue to increase despite the regulations. There's increasing evidence supporting behavioral and pharmacological interventions for vaping cessation, and we're really encouraging that we use a holistic, overall, kind of multi-pronged approach to treatment. In addition to that, we've talked about the idea of further engaging youth, so exploring their motivations for why, their goals for treatment, and their reasons for initiating and continuing their use of their vaping device. And so this is probably, at the end of the day, where I think most of us would agree that's the most critical piece, is really to take the time to explore and discuss with the young person where their motivation is, and to have it as being an ongoing part of the visits initially and then with follow-up. And as we can see, that was critical for TJ. So I'll stop here. We certainly, I think, and Natalie, you can let us know if we can, maybe we can answer these questions after the webinar today. We can send answers by email or whichever way would be best. But that's where we've landed today. So if there are questions, and I think Madelynn, you might have some time to stay as well, but I'm happy to stay for a bit and answer those questions as well.
Awesome. Thank you both so much. That was an awesome presentation and discussion. I know vaping and youth, there's a lot to discuss there, and it's hard to kind of put it all into 1 hour. So we appreciate you, and thank you so much, everyone, for participating. Yeah, if there were any kind of questions that weren't answered, you may feel free to email them there, or if you do have a couple minutes to stand by, that'd be awesome.
Yeah,
Okay.
Absolutely.
If not, I can kind of wrap up.
I think there's a Tanya has raised her hand.
Oh,
I'm so sorry, Natalie, I can't see the chat. I can just see that it pops up as a notification on my end. Yeah.
I don't see any questions as of right now.
Oh, okay, no problem.
I think they're clapping.
Oh, okay. Okay. Okay.
All right, so then I'll kind of wrap up, and then yeah, if there is anything outstanding, please do email Maddie and Trish and ask them any outstanding questions. For now, if you're okay to just go to the next slide, Trish, that'd be awesome. I think
you'll have to tell me where.
Yeah, I guess at the very.
Is that the end one? I'm so sorry.
Yeah.
Is it?
No, that's okay. Keep going. I think there's right after that. Is that?
Yeah.
There we go.
There we
go. Just another reminder for everyone. So if you're interested in receiving a letter of completion, you'll receive an evaluation and post-learning assessment by the end of tomorrow, and you'll have 1 week to complete that, and then you'll receive your letter of completion in a couple weeks. And you can just scroll through one more time, click through one more time. Awesome. So yeah, speaking of vaping and all of the questions that come up, kind of timely because next month we have Dr. Peter Selby and Dr. Milan Kara, who will be bringing us through a vaping Q&A as well. So that's awesome. So feel free to join that as well. Registration will be opening soon for that. For now, thank you everyone for joining. If you would like to watch this webinar again or watch any of our previous Teach webinars, an archive can be found on our website. For now, thank you everyone. Have a great rest of your day. And thank you both again for your awesome presentation.
Thanks for having us.
Thanks. Yeah, thank you.
Of course, anytime.